I grew up in a small town in Wisconsin. The population was about 700 people or so. I had some health issues of my own, so spent a lot of time in clinics and hospitals. I had some really great doctors that kind of spurred me on to want to make a difference in people's lives. I usually wake up probably around 6:30. I do have a son who I have to get off to daycare, so we spend our morning kind of getting ready together, make sure he eats breakfast, and then we leave for daycare probably around 7:30, hopefully. And then I get to here at Westfields usually around 7:45. If it's a clinic day, we usually have patients that start around 8 o'clock. And then, depending on what year you're in, we see patients either every hour, every 45 minutes, or every half an hour. We always work with an attending provider who we can ask questions to and staff patients with. Lunch is obviously around noon. We do get free lunches here, which is great. We usually all as residents eat together and attend noon conference, which is actually streamed in from Methodist Hospital in St. Louis Park, which is the program we spend our first year at. The afternoon in clinic usually starts around 1 o'clock p.m. as well, and then we're done usually around 5 o'clock p.m. I specifically will go pick up my son again from daycare, and then we usually go on some sort of walk when it's nice outside. There's a lot of different hiking trails around here. Usually watch some TV in the evening, eat some dinner, and then go to bed. I chose to go to the Western Wisconsin Rural Family Medicine Program because there's a huge need for good doctors in rural communities. There's a lot of underserved populations who really benefit from a doctor who has experience in a wide depth and breadth of different problems that they may be facing. I really liked the aspect of the Western Wisconsin program in that we spent the first year actually in the cities in more of an urban setting, and then transitioned out to the rural setting the last 2 years. So even if you're questioning, like, is rural practice good for me, you really do get the best of both worlds in this program. The rural experience enhances training specifically because you're one-on-one a lot of the times with the attendings and providers you're working with. The other way it enhances learning is that you really get to go at your own pace. So if you are wanting to take on more responsibilities, a lot of the providers are open to having you do that. This residency is preparing me for my future practice in that it's giving me a real taste of what being a rural doctor is. We, as family medicine doctors, are really kind of generalists, especially out here in the rural setting as well. You have to have a huge breadth of knowledge about everything that patients can come in with. Some of my favorite aspects of a rural family medicine practice would be just the ability to have continuity of care with patients. And I think specifically with a rural practice, that is just amplified. You see mom or dad and they bring their kids back to you, so it's really like a continuity of care for the whole family. The thing I like about the Amory New Richmond community is the warm atmosphere. You know, you'll walk into the grocery store and people say hi to you. I have my son with me sometimes and there'll be people who say hi to him and kind of interact with him, so it's a very welcoming area. I chose to practice rural medicine because I feel like it's giving back to a community, and specifically a community that I'm an integral part of. So I love the feeling that I'm neighbors with my patients and that I have the opportunity to see them out on walks or when I'm just doing my day-to-day life. It's a fun feeling that you're making a difference in people's lives in a community.